This presentation is about an interview with Michael Leary, Executive Director of the nonprofit Regional Primary Care Network in Rochester, New York, regarding the professional communication required in his career, with an excerpt from a county tax appraiser manager in Nashville, Tennessee, Vivian Wilhort. Nonprofit organizations' main communication problem is the nonprofit and its societal relationship. Nonprofit communication has to establish networks, relationship, trust, create shared visions and norms. Nonprofit communication is shaped by its explicit commitment to promoting social good, and it has to communicate this to the large number and type of stakeholders who are invested in the organization's success. In a conversation with Michael Leary, Executive Director of Regional Primary Care Network, RPCN, the director told me about his daily correspondence in handling the nonprofit business that he is in charge of. A walk through a normal day of his correspondences is he typically receives 200 to 300 emails to his work email address per business day, which consumes a great deal of time in identifying whether the messages required attention, and if so, developing the appropriate written response. He sends between 20 to 30 emails per day on average. He conducts an average of 3 meetings per week, which he documents in minutes. He has 2 to 3 board meetings per month requiring extensive minutes and preparation. On average, he has 4 meetings per day, which requires either writing or reading on his part. In addition, he generally receives between 10 to 30 text messages per day and have 2 to 4 unplanned, lengthy telephone calls. So, Leary has a lot on his hands as communication goes. So, how does he get all this communication passed on to staff, clients, and stakeholders? And is there a specific format that he uses to communicate? The director says he has several ways that his organization communicate with staff, clients, and all stakeholders to get the internal work done and mission message out for the organization. The director holds quarterly all-staff video conference calls, which he leads, and in which important communications are conducted. Historically, he said, the nonprofit has also published a monthly newsletter, but this is now replaced with an active intranet in which postings are done on a daily basis as significant items need to be communicated. He sometimes posts occasionally without a specific schedule. Additionally, he has an active management communication process that includes transformation teams consisting of subject matter experts in various aspects of his organization's operations, which collectively report to a transformation leadership team on a weekly basis. He also holds weekly meetings of his direct report under the core team. He has routine and extensive communications with RPCN's board of directors, including a monthly board meeting and a monthly or bi-monthly meetings of the board's executive and compliance, finance, planning, program and personnel, quality improvement, and sub-recipient oversight and compliance committees. The nonprofit communicates with patients through the organization's public-facing website, information screens in the waiting areas, the patient portal, and through telecommunications reminders of upcoming appointments. The nonprofit's healthcare providers conduct patient education on some levels in most encounters as well. Leary's philosophy on communicating with stakeholders is generally he communicates as openly, clearly, directly, and honestly as possible for any given circumstance. There are some items, he says, that cannot be communication due to confidentiality, liability risks, and strategic reasons, but outside of those constraints, he believes in full disclosure and clarity. I found that the county tax appraiser, Vivian Wilhort, who manages in Nashville, Tennessee, who I interviewed also about communication in her profession, has the same philosophy of communication with her staff and stakeholders, communicating as openly, clearly, directly, and honestly as is possible for any given circumstance. It appears that this philosophy of communication might be the standards for most managers. When Leary sends out correspondence, the tone for his organization and communication is as such. He says letters are, of course, the most formal type of communication, though email has become the routine substitute in written communication for what in the past years was communicated by memorandum or letter. Typically, he uses a formal form address in a letter: Dear Ms., Mr., Dr., etc. In most email communications for correspondents whom he knows, he uses an informal opening like, Hi, Wanda, for example. In terms of verbal communication, he doesn't really differentiate significantly between modes: in person, telephone, or video conferencing. But of course, he says there is some variation based on the MIU, internal staff versus board of directors versus government officials, and the topic. He says he tends to elaborate much more in verbal communication than in written. He has been known to go down rabbit holes. When he is talking with an individual or small group for the first time about his organization, he tries to get a sense of the person's or group expectations, formality versus familiarity, and adjust his communications accordingly. In most cases, he tends toward open and familiar communication, and he often attempts inoffensive or self-deprecating humor as a way of making others feel comfortable. As far as presentation goes, he says, well, a presentation is implicitly formal. Assuming this is the case, he typically prepares a PowerPoint presentation with outline points of discussion. Then he speaks to those points based on his knowledge and experience. So, I wanted to know if Leary communicates differently with stakeholders. He says he doesn't, and as he mentioned earlier, as a general rule, he always communicates with everyone as openly, clearly, directly, and honestly as is possible for any given circumstance. He says there is a reason if he communicates differently with different stakeholders. It is whether he is representing his organization directly or whether the communication is part of a coordinated effort involving other organizations or individuals. For example, when he attends meetings with state or federal legislatures, there is generally a set of legislative priorities that the sponsoring organization, Community Healthcare Association of New York State or National Association of Community Health Centers, asks him or his nonprofit contingent to communicate. In these sessions, he will include pertinent communication about the organization and his organization's peers organization in order to relate the legislative request to what's happening in the legislative district. Will Hort, the county tax appraiser, mimics Leary's attitude about treating different stakeholders the same. She, too, says she doesn't treat people differently. She tries to stay consistent in how she treats people because she says this helps with the credibility of the organization in speaking with clarity and honesty. The communication guidelines or rules for his organization, Leary says, are one you would most expect. Don't cut others off. Don't belittle ideas. Don't personalize comments. Ask questions, even if you think they're stupid, etc. He says his organization has had problems with some senior staff who tends to, unbeknownst to themselves, speak in harsh tones and verbally confront others during meetings and calls. Virtually all of his meetings are calls as well because the organization staff is spread out all over the Finger Lakes and Mohawk Valley regions. Yet these same staffers were very effective in their roles and essential personnel. He implicated a standing expectation of using video conferencing in place of telephone calls as one way to address this problem. The body language and facial expressions enabled by this helped significantly to reduce incidents of hurt feelings resulting from meetings because both the harsh speakers became somewhat more restrained due to awareness of their unspoken communications. The recipient of those communications could see that in many cases, what was previously perceived as demeaning or harsh was clearly meant in a less aggressive way. These issues remain somewhat problematic and needs to take additional steps to reduce the incident of harsh, demeaning communications. If there is a crisis situation, Leary says that his organization is bound by the Center for Medicare and Medicaid Services to have a formal emergency management plan, EMP, as defined by the Department of Homeland Security. This is the same structure required by all levels of government and their agencies, hospitals, nursing homes, etc. There is not a simple answer to this question, but generally they have to follow the guidelines of crisis communication, of communicating with staff and stakeholders as detailed in the emergency management plan. Lastly, in conclusion, I wanted to know if Leary was happy with his organization's format and procedures of communication, and would he like to see things change.
He says that communication in his organization is an ever-evolving process. He doesn't expect he will ever be completely satisfied, but he's comfortable that his organization generally communicates well and is always finding ways to improve communication.